appreciate it. Appreciate your time. I will make sure to get everybody their gift cards, but welcome to the NextGen upgrade training. So on Monday, that would be October 13th, we're going to upgrade. We're currently in NextGen 6.2. We're going to NextGen 8. The last patient is supposed to be at 2 o'clock tomorrow, so you finish by 3, so you have a couple hours to clean up all your encounters as a priority. The rationale is that there's a background fixing of many issues. It is leaner, cleaner, and less repetitive. I'll show you that. And you're the appropriate group for this. I had to put that on the handout in case it goes to other people. So I'm going to give you the overview in words, and then we'll look at the picture. The frame, the edges is new. However, the most important thing, you're going to have to set one little preference that I'll show you. It's in the category section where you view documents. It's called Tree View. Another change is that right-clicking, you sort of have to remember where you can right-click, is now replaced by 3 dots. So anytime that so it sort of looks like a colon, but with an extra dot like that. Remember that punctuation mark? Start homepage has no changes. The allergy module has a checkbox for intolerance. SOAP has some very minor updates here and there. The favorites come over. The meds, immunizations, and labs have some minor updates. And the big news is for the women's health staff. Prenatal detail allows you to add problems and notes in my phrases, and lab results populate from Quest. So this is the frame, but I'm going to stop sharing and show you in the live system. So just give me 1 second to show you live. So this is the famous or infamous development database. So just give me 1 second. Okay, to move things a little bit. That little bar at the top of the screen doesn't always want to cooperate. Okay, there we go. Now, let's start from the top and work our way left to right. See this file menu? No different. See the edit menu? No different. The view button, the one little box you want to check is this. Something disappeared over here. It's called the ASPO tool view bar. And what that is, ASPO stands for Assessment Plan Subjective Objective. And you can watch your note build in this current one. There you go. That's how you can watch it build. You can also see the previous note, except there is no previous note because it's a test patient. So we're back to view. This really hasn't changed other than that. Tools, this is where you can set preferences. Some of you may remember that. That hasn't changed. Your preferences, again, should come over. Admin, that hasn't changed. Utilities isn't changed. Window and help, no change. Now, the logout button's the same. Whoops. Close patient is the same. Coming across, this stayed the same. The patient lookup, but all these buttons stayed the same. One thing that's different is this document icon that lets you generate documents. We now have to put it up here. So if you like that button, that's the only place you're going to be able to find it. So what you have to do to get it to appear on day 1 is click that little document icon. So I can make it go away. See, it's gone away. Now it's back. For those of you who bring in some images or other documents with the image button, same thing, but it's not a common workflow. I can explain that more. Now, let's see what we got here. We've got this little arrow. So see how we're just going across. See that little arrow? Goes down, it goes up, goes down. So this is now called, instead of the patient information bar, it's now the patient information card. Old wine in new skins. So none of that's changed. Just a reminder, that nice little underline with the name takes you to patient demographics. That's not unchanged. What's nice here is that this is the patient's gender and this is the patient's gender identity. That's nice. It's really no different about the portal icon is no different. The alerts button looks a little different, but it's right here. So see, I'm just hovering. If I left click once, it brings us back to the same alert area. If I want to create a new encounter, it's here, and I'm going to do that. And then that's where the tracking button will be. So just give it a second, it's coming, and see how it changed from new encounter to tracking? There you go. And we see the medical record number here, so you don't have to dive into GPHA patient. It's still there if you want it, but you don't have to dive in. I'm just gonna close it so it doesn't distract us. We do have encounter insurance here, which is nice. Reason for visit will populate in here. One pharmacy is here. PCP and rendering provider are here. So we're good. Now let's look at these little blue hyperlinks. The Azara data link is right here. It's not going to work in the test database because it's not hooked up to the internet. But now you have Azara. You don't have to click in and click in. It's right there. Tasking, you know how you can task yourself? That's there. We don't really use the medical Health Information Services uses PHI log, and we don't have anybody from that team here. So I'm going to keep moving. GPHA patient I showed you. Telephone calls, no different. There it is. HIPAA, we're not really using. Advanced directives. We do have a medical case manager on our call, and this is no different. Hasn't changed. Screening summary. Still a great place to go if you want to document tobacco use. This is a good spot to document it if you like to document it there. OBGYN details, still the best place to find the LNP. I can still enter it in here like that, save and close. And then it'll become visible in the vital signs template. So all this is the same. Now let's keep going around the edges. See this little double arrow? It moves out, and that's where your encounters went. So now you can make them hide, or you can bring them back. So here's our encounter for today, and you see the encounter I did yesterday, right around the same time. How about that? Now remember I said something, so the categories, so when you click the little arrow over here, you can get like a preview of what's going on. That's kind of nice. It's a little cleaner, a little easier. You can open, and let me stay on this line. The categories is where we get our documents. See how mine is set at tree view? It remembered it from the last time I set it. But when it comes up out of the box, it will be in list view. And see how it's just a list? Now you might like a list. You might want the last 3 things that were brought in. And that's one way to get it. Generally, I think most of us are going to be happier with it sorted. But again, once you click it, it stays, this is your personal preference. It doesn't change it in the patient's chart. This is your, this is your view of it. It does allow you to look things up. I haven't experimented with that too much, but you can look and see where was there a murmur somewhere. This is your refresh button. And this is a little preference button. The main thing, and you may need to do, is move your remarks. See how I just moved it? You might need to move your remarks around. I think that can be useful to have the remarks just next to the date, but I'll let you play with that. That's not major. So I'm going to go back to encounters because that's kind of been where we are. And if I come back here to my visit yesterday, I can see some things that happened. I put all kinds of stuff in. Maybe somebody else practiced in my chart too. It's not that important. Now, if you come down along the side, so I'm going to actually fold this in and close this so it's not so busy while I show you the rest. I think the busyness is distracting when you're new. I think it'll be fine when we're in it. The little flower is allergies. Same little flower that's on the top icon bar. So all I'm doing is hovering. Now, if I left click it once, it brings me into the full module. All right, module really, oh, I forgot to show you one thing. See, now there's an intolerance checkbox. How about that? The miracle of computers. Now we come over here to problems, and all I'm doing is hovering. I'm just moving my mouse from one thing to another. If I left click on it, one time, I'm only left clicking once, it brings me into the problem module, and it looks the same. Now we've got meds. I'm hovering. It's the same med button as on the top toolbar. So if you don't like it, seeing it on the top toolbar and you just want to use it over here, you can take it off your toolbar. Your call, you do you. One left click, I'm in the med module. Now the thing I want to show you about the med module when it populates is now it will give us morphine milliequivalents per day, and total morphine milliequivalents. In other words, this would be the morphine milliequivalents for this drug, and this is the total. It only works if you use their SIG, but okay, that's fine. There you go. And morphine milliequivalents per day is up here. This is a regulatory thing that NextGen had to add. So we're going to just move the meds away. The little needle looks like shots, so you can hover, and now you can order your shots. But I'm going to close it just so it doesn't distract us. The calendar is where the appointments are. If I left click it, nothing happens. So let's see if I can get it to come back. Left clicking here doesn't do anything. The heart with the widened QRS complex, that makes me crazy. Every time I look at it, I'm like, it's a widened QRS complex. It bothers me. But anyway, we now have a nice long list of vitals. Whoops, I'm sorry, I moved my mouse. One more time. Nice long list. If I left click on it, it brings me into the history. I don't add vital signs here. I add it in the usual place, but I get like a big history. I kind of like just the hover. I think it's pretty cool. That actually works for my brain. Anyway, what's left of my brain, I should have said. Moving along to orders, this just gives you a list of orders. The test tube and the bone. If you want to use the red and green test tubes that's up on the top toolbar, it's still there for you. And now it's taking me to the orders module. So there we are. But I am going to close this just so we don't have visual clutter while I'm trying to explain things. The little beaker gives you your results. Now I'm hovering it and nothing's happening. So if I want to see the results, I have to click. And it gives you this abbreviated review of results. If you want to see the whole schmigegi, as I like to say, all the results, actually that's the preview. Yeah, if you want to see the actual result, you're going to have to go like the way we've always done it. You're going to have to go in and click on the results like this. There's not going to be results here because it's the demo database. And you can see here at the bottom, it says development environment. So I'm going to close this out. Where was I? This is care guidelines. Now, we're not doing care guidelines during the go live. Dr. Ram and I will work this out and we'll roll it out in like November, December. So don't worry about care guidelines now. This is a data share button and we're not using it right now. This is the diagnosis module so that's different than the problem list. You know, the patients can have more diagnoses than what's on the problem list, right? And then this is where the sticky note hid. And again, you can move these buttons around. I believe can I drag this one up and down? You can move them. I'll show you how to move them in a second. See how this has little lines? It looks like a sticky pad. So the way you know something's in it is it has lines on it. See how I made the lines go away? And now I'm going to make a sticky note come back. Let's see if I can write text, right? And now the sticky note came back. So that's how you get the sticky notes. I believe I can move, this is where I move it around. So if I want to move this around and have my sticky note at the top, that's how I can do it. If I want to take data share away, I don't have to look at it anymore. And then I click apply and see how that data share button's gone and my sticky note's at the top. So you can move the buttons to make you happy. I think that's everything I want to say here. Yes. So let me open a template. Now there's two ways to do it. I can do it right here where it says open template, or I can go up here in the blue boilerplate. I think it's a little easier to click here myself. You can also, there's a filter and only look at certain things. I'll leave that up to you. But let's open the template. And for the purposes of this, I'm going to open up homepage. And just give it a second, we'll come. And it looks like we have the wrong visit type for what I want. I want this to be an office visit. And you know what? I'm doing this in the wrong order. I don't want this to be an orthopedic visit. No offense to Dr. Smith. I just want to do like a family practice visit because it'll look better. So see how like I shouldn't have picked the visit type first and now it's making me pick it again. Sorry about that. So now you see how everything here looks kind of the same. And again, it's gonna make me, before I do anything, it's gonna make me address these allergies. So that hasn't changed. And I want to go back here to Star homepage just to make a point. There's a number of ways to review the chart. I suggest that that everybody review the chart here in homepage for anybody you don't know, because this is going to be the place where you can get all of your plans, your problem list, which you probably already reviewed already. The other important spot is you can look at the communication history. This is where you find out the patient's been calling 25 times for something, and so you can address it. You can see the past med-surg history very easily. When you know the patient, there's a few other nice ways to review the chart. So you have more options. So what I want everybody to see is I have my vital signs panel moved up. I can move it down if I want to. But what I learned from Patty Weir many years ago, one of our wonderful family nurse practitioners, is that if I miss a bad vital sign, then the party's over. So I'm not having any fun if I miss a bad vital sign. The MAs will enter in will enter stuff in for you, but you can enter in, you can enter in as you go. It will give you, it'll still flag bad vital signs. The LNP that I entered is still good. So I'm just going to click save and close. You see how that works. And you can see that right here. I will go in order to show you these. So see how under general, there's an interpreter detail section. If you want to add your interpreter details here, have at it, but it's available for you. The one thing I do want to show you is this configurable questions. The medical assistant screening questions will be coming here. So I'm just telling you, you don't have to do it, but I'm telling you, they're not going to create a new reason for visit for screening questions. NextGen built that into us. Then for a reason for visit, you can still feel free to say that you talk to the interpreter Spanish, 1, 2, 3, like whatever. You can say that here. There's nothing wrong with that. So I am going to close general and I'm going to close the vital signs. You don't need to work like this when you're working, but I wanted to work like this just to not have things be cluttered for you. The big change in the history of present illness templates is, look, we have an HIV PEP prep, HPI. That's exciting. So you can use that if you need to. Certainly the prep team's happy about it. I had this because, the administrator for the prep team, I had this put on all the specialties. So family practice, internal medicine, gynecology, and pediatrics. It's not on OB because there's not enough room. If the OB people want it, something else has to come off their list. There's 13 slots. So, and then it's not on ortho for obvious reasons. One thing that's also new here is this HPI history. You can see the HPI history. So there you go. Now, you may have friends who have a version of NextGen somewhere else. We have disabled pulling in an old HPI. We're going to enter that in fresh and new to prevent the idea of can charting. But everything else here has stayed the same. One question that came up the other day is, where's the standing orders? They're right where you left them, right here. And this will be here in all the specialties. So we're done with reason for visit. That's not any different. The history summary, this is not different. But see how the colors are a little different? It really hasn't. I haven't found anything in there that changed. One of you may correct me if you feel that I have missed that. Same thing with review of systems. You can see the history. We can't pull in old reviews of systems. Don't forget that you can do the quick loads here. If that's not clear to you, I will explain that at the end with questions, or we can meet privately. But this really hasn't changed either. Same with the physical exam. However, now we have a history button. and you can see what previous physical exams were in here. It's nice to see, am I the only person who brought a murmur stethoscope to work today? Am I the only person who felt a spleen and so forth, or heard a bruit if you're taking care of an adult? Office diagnostics is the same thing as standing orders, takes you to the same place. And so that's unchanged as well. We don't use the narrative notes section. Now let's go to assessment and plan. So under assessments, nothing's really changed here. Don't forget the add assessment on one-click checkbox. That makes things a little easier. My plan is not changed. AP Details has a couple little updates in it. So actually, let me add an assessment for the purpose of doing this. And see how I added that on one click? I didn't have to click it a second time. So let's go to AP Details. Now you can see here, wait a minute, there's something I wanted to show you. I think I got myself out of order. All right, let me go through this and I'll find what I wanted to show you. You can go back and do assessments by history. Hang on one second. Now I'm like, there it is. I meant to show you this before I jumped into assessments. That's what I meant to do. You can pull your assessments forward. So this is what I wanted to show you. Sorry, I got myself out of order. I haven't done this training enough times that I do it exactly the same way. I'm getting there. So you just click on it and it falls down. And then you click copy assessment plan and close. Boom, your previous assessments come in, right? See all the text that you wrote. So if that helps you, great. For many of you, when you're doing hypertension, type 2 diabetes, hyperlipidemia, you're doing those kind of visits, it really is going to save you some documentation time. Now I can jump into AP Details. Okay, so none of this has really changed. What is different that you can't see is when you go into My Phrases, Common Phrases, now you can search for things. So I love hematology. If I write in iron and click search, notice that I did not hit the enter button like I did 2 nights ago, because it'll pop you out of there. You have to use the search button. But you can search by words, which I find very useful. This button here, add assess phrase on one click, definitely click that. It will stay clicked for you. So there you go. And that's a nice little thing that it just adds it on one click. I kind of like that. What else did I want to show you? Okay, now if you want, you can add PAQ plans. We don't really use that workflow, but if you want to add a phrase in your PAQ, it will be available for you, but you add the phrases here, but use them in the PAQ, if that makes any sense. So that's to me, this is all minor updates. We still don't use labs. Don't try to order labs from labs. The diagnostics menu has not changed. The referral menu has not changed. We still don't use office procedures. We still don't co-sign orders here, but none of this has changed. All right, so I did assessment and plan. Now we're going to go to finalize. One tiny change here that will make things easier. You know how we sometimes don't want to charge for a visit? Ta-da, there's a no charge visit. Instead of going in here and going another menu in and trying to remember which menu you have to use, that's how you make a no charge visit. Boom, and you don't have to remember what it is. That'll make things a lot easier. And then the document's going off to the PAQ. Now, it may not go to my PAQ in this environment. Give me one sec. I just want to see if this is around this. Okay, never mind that. And yeah, it created. Is this the right one? No, 916. So it's not going to the PAQ in this environment. I can try it from the navigation bar, which is, by the way, right here. Let's click on preview and see what happens. Let's cancel offline document generation and generate now. There we go. Now it's generating. It goes to the offline document generator in a practice environment. The only way you can really see your note is to do it this way. So it looks pretty much like the note we had. If you notice something that's not right about it, let me know, but it looked okay to me. And we can fix some of these things the way they print out. All right, now let's see. I have covered everything. Merlita and Adine, did I miss anything? All right, they're not saying anything. That must mean I'm okay. All right, so let me stop sharing this and go back to my PowerPoint and make sure we covered everything. And there we go. How are we doing time-wise? We're doing good. All right, so we saw that, we did the tour. Just remember, nothing's taken away, just relocated. We reviewed the frame, and your favorites are not going away. Your favorites are coming over. Just remember, gender identity is now here. We have their actual gender up here. We have gender identity on the patient information card. We went over the patient navigation bar, that it's still there, and the medical record number is right here in case you need it instead of having to jump into GPHA patient. Just remember, we talked about real estate control. I think we saw that. And we saw the screen arrows opening and closing. The pre-populated documents, you're going to have to put that button up there. And I showed you how to get it on the toolbar by clicking on the document icon and getting that there. That it didn't go away, but you are going to have to bring it back yourself. The 3 dots are there, and it gives you some options. We went over all of these in depth, so we don't have to do that again. You can add some favorites in to just get your display view the way you like it. You do need to set this tree view for yourself on day 1. Otherwise, you're going to think that you can't find any documents, because some of our patients have a lot. There is a preference so that you can select certain categories to view. I didn't show you that. I don't think it's such a big deal, but you can select it if that's what you want. The documents will appear here. By the design, they don't display in the practice database. You can rename mislabeled documents. We can go through that at the end if that's something you want to see. You don't have to, though. ASPO, that's kind of a nice feature. You can see the last note and you view it. You click on the view icon to get it. You can watch your SOAP note as it builds. I guess that's nice. Azara is right here. We talked about that, where the Azara data link is. And we talked about the ASPO. I probably have this slide out of order. Please forgive. I just put some directions in into how to save a favorite template. If this isn't clear to you or you need to save some more templates, let me know. We can work on that separately. You can add icons by clicking at this down arrow at the top of the toolbar. The icons under the picture, that was a question I got during the testing phase. We never used that little mail button. That would have brought your email in. The little phone went right over here to phone call. The little task button, like send yourself a task, went right over here. And patient tracking went right over here. And we saw how patient tracking, it's an open template button, and it turns into patient tracking once you have a template open. Easiest place to record LNP is OBGYN details. As we saw, I'm still mad that they didn't put last menstrual period as a vital sign. I don't think I'm getting over that. Smoking history, we talked about using the screening summary. If you like it, that's fine. Take home messages on the frame. Nothing was moved, it was relocated. Just add that generate document icon to the top toolbar and select the tree view. And I recommend that you take some time to practice. 3 charts in development is enough. I wrote no documents will show. You're going to have to generate them. And I think about 10 minutes, 15 minutes will get you acclimated to the frame. So I'm going to stop sharing. I'm going to take some questions, and then I'll go over a few of the template enhancements. and some workflow things. If there's no questions, I can move on. You can just unmute and ask questions.
No,
Hey,
Jackie.
Jackie. Oh,
I'll hold.
Okay, Dr. Jordan, let's let ladies go first. What's your question?
I was actually trying to get into the development environment to practice, and I saw how you did it the other day, but I'm in like the next gen like flow now, and I can't get to the development environment.
So it may make it easier to close out the real production next gen. You can have them both open, but it's going to be confusing. Um, Let me just show you on my desktop how to do it. Let me close the patient. Give me 1 second and log out and show you how to log into it because there's a little tiny trick to it since you asked. Give me 1 second. All right, now let's share my screen. Give me 1 sec. I have 3 screens, so I have to be careful how I arrange things so you can see it. So anyway, this is our son. He's going to be 29 soon, and me, and my husband, Al, Alexander Hamilton, and Al's brother, Chuck, who unfortunately passed away from the COVID, from multi-system organ failure in January 2021. That was really a shame. Remember that bad month? We had a bad month in my family. Anyway, this is the development database. I moved it over here because I think there's too much stuff over here and it annoys me how many icons there are on these desktops. So anyway, next gen development, I think everybody here knows I don't like clutter. If you click connect,
But wait a minute, Jackie, I don't even have that icon.
you don't have next gen development on your desktop?
No.
Are you sure you went through every single one of these?
Yeah.
It might be
So
the NextGen DEVL on your desktop. That's what it is on mine.
NextGen DEVL, yeah.
That one second, second from the top, second from the right.
Okay.
Oh,
Okay. Actually, I'm on my home computer. Maybe maybe that's my
that's
issue.
why. That's why it's your home computer. The icon didn't get pushed out to
Okay.
it's right. So that's how you get there. So
Okay.
that's how you get there, and it's not going to be on your home computer. They're not going to put it on your home computer. Then you click connect. Thank you, Adine. Then you enter your normal username and your normal password. And you can't see my password. That's okay. Unless you hit that little I button. I'm not going to do that. My password's very special to me. All right. And then what you're going to see is this. I have 3 screens. Give me 1 second. There we go. I have 3 screens.
Okay.
So
Then the Okta Verify.
then
Okay.
the Okta Verify. So hold tight. I got to Okta Verify because, it's the way we do it. So then there you go. So I verified. So give it a sec. Now there's one little thing you got to do. I have a slide on it. Wait a minute. Then where am I? You click on NextGen 8 and then you click on Enterprise EHR. I know. How much clicking can you possibly do? As much as there is. So anyway, give it a sec and I'll show you the little trick. This little, hang on
Jackie,
1
really
second.
quickly, I don't have NextGen 8.
So you're going to have to send that to IT.
Okay.
I don't know why you don't have that. I can't explain it. They're going to have to like remote in. This button here where it says Windows integrated,
Mm-hmm.
it's going to come up as one of these other 2 things. You have to change it to Windows integrated. Then it
Okay.
will stay changed and click log on.
Okay.
And then you're back in.
Okay.
Well, I'm back in.
Right. Okay.
Right.
I got you.
So I'm going to,
Okay.
let me move this out of the way. And maybe I don't want to do that.
And you
All
also
right.
have to make sure at the bottom it says development of environment.
Correct. And these
Gotcha.
are real patients. What I had said last night was that on Tuesday, is that it was anonymized. I'm incorrect on, I made an incorrect statement, but anything you enter into a development chart is not going to hurt the patient or carry over to the production environment. We're not copying this development environment. We're copying the settings, but not the actual patient data. Did that make sense to everybody? All right, Dr. Jordan, do I have you complete?
Yes.
You're gonna,
Yes.
okay. And then Dr. Lafayette, do I have you complete? I'm gonna assume
Sorry.
I do.
No, because I don't have NextGen 8, so there's nothing I can do.
Right, you're gonna have to put in a ticket to IT for that.
Done and dusted. Thank you.
Okay, gotcha. Patty, you have a question.
I do.
Whoops, wait a minute. I tried to unmute you. I'm sorry. You're still muted, I think. Yeah, there we go. Sorry about that. Go ahead.
So when you're finishing your chart, there's a little button at the top left that says chart complete. I don't see that anywhere.
A little button at the top that says chart complete.
Little round button when you're on the with the patient.
Right, let me see. A little round button. Give me a second. It says chart complete. Do you mean in prod or in development?
No, it was not. It's not the new charting. I don't have that.
Okay.
But the old chart up here where there was a little circle.
Is there the patient tracking button?
The little
No.
So
circle.
you'd click on it and it would give you like
Yes,
with
it's the
provider,
patient
waiting for
tracking.
provider, those
Yes.
options.
Yes, that's this button, Patty, right here. But you're also thinking that you may be thinking about your inbox and your appointments. That hasn't changed. We actually didn't go over that. But see, if I were seeing a live chart, I would see that it was complete there. So that hasn't changed.
Okay.
All right. Dr. Jones, I think, and Dr. Maybine had a question. How about we do Dr. Maybine first? I can't hear you, Dr. M. Let me see if I can. No, you're going to have to unmute yourself, sir. At the top of your screen, there's a microphone button towards the right.
I think I'm
There
on
we
it now.
go.
Yeah.
Yep, yes, you are.
All
What
right.
can I do for you?
I'm certain I'm going to have some questions as I go
Of
through this at
course.
work.
Of course.
So what do I do? Do I call you
Yep,
or
you can call
IT?
me. You can call me. And if we need IT, then we can call IT.
All
All
right.
right.
So I'll go on Outlook and put in a ticket for NextGen icon because I don't think I have that yet.
Because if you don't have it, then put in a ticket. Yep.
Okay. All right. Thank you.
All right. You're welcome. Dr. Jones.
Yeah, I had a couple questions.
Go.
One is kind of like with Dr. Jordan about on a home tablet. If you don't have that next gen development icon, you have to call IT to have them put it on.
So for a home device, you can ask them, but my guess is they're not going to do it. They're
Well,
going
how
to
can
ask you
you?
to use a GPHA computer.
Oh no,
Um,
no. When I'm talking about my GPHA computer, it'll be on there.
It should be, yeah.
Okay. Then the other question, when you went to pharmacy, they had primary pharmacies. Are we able to put in a
Yes.
secondary pharmacy?
That is a good question. So let me show how to do that. The primary pharmacy is here.
Mm-hmm.
See, Dean knew that this question was going to come up. And there's pharmacy 1, just
Mm-hmm.
like that. And pharmacy 2 is
Oh, so
here.
we can still put it
Generally,
in.
the MAs, yeah, we'll put this in. This is view only here. I don't think you can change it from here. I
Mm-hmm.
think it's just view only, save changes. Let's see what happens if I try to click on it. No. So, yep, you would have to go to GPHA patient to change it.
Mm-hmm. Mm-hmm.
And it is still going to be visible. The pharmacy choices are still going to
Yeah.
be visible. If I click the send button,
Yeah. Mm-hmm.
do you want to click no? Yes, okay, so click no.
Mm-hmm.
There we go. And then,
Yeah.
so there you go.
Okay. And then
Other
another
questions?
question, another question under the medicines, when you mentioned about like for controlled substances and the morphine equivalent.
Yep.
If it's like for sickle cell patients, they're usually outside that range. So are you able to override that? Or if you're
Yes,
outside the range,
it's just giving you information. It's not telling you you can't do it,
okay.
but it's doing the calculation for you. That's all.
Mm-hmm. Oh,
But
okay.
now I get it. The sickle cell patients need more. I get it.
Mm-hmm. Mm-hmm. And on this new system, like the PDMP, is that in here?
Yep, it's right where we left it right here. And then I have a couple words to say about PDMP. the PDMP, if you have not signed up, it's only for the medical providers. So the physicians, the nurse practitioners, the PAs have the access to the PDMP. And you have to have signed up for it. As
Mm-hmm.
soon as you sign up, it works. So if you click on it and nothing happens,
Mm-hmm.
that's not finding anything. It means you haven't signed up for the PDMP, but it works nearly right away. And oh, check that out. It's giving me something.
Mm-hmm.
You know,
Yeah.
it's giving you something. So yep, PDMP hasn't changed. Works
So
right
if you're
away.
not signed up, will it like prompt you to sign up right then, or you have to
It
go
will
somewhere
tell
else to
you
do it?
you have to go somewhere else. And so you have to go out to the internet and Google Pennsylvania PDMP sign up, and it'll take you to the right spot.
Mm-hmm.
Really quickly, Jackie,
Mhm.
my PDMP used to work, but it doesn't work anymore. So I don't know what happened. I used to be able to do it. I can't do it anymore.
So my suggestion is double check to make sure that it works when you log into the PDMP on the outside. Like double
Okay.
check that. And if it's still not working, put in a ticket to IT and CC me on it. But what IT is going to say to you is what I just said. You got to double check and make sure that it works at the PDMP.
Okay.
Other
Hey,
questions?
yeah, yeah. One other question. Okay, with this upgrade, what was is this upgrade supposed to make things simpler?
That's a good question. Thank you for asking. And it is. And as I mentioned on the first slide, it it smooths out some things, and it should make it possible for us to use care guidelines in a meaningful way. I personally think this is a little easier and a little smoother. There's a lot of background stuff that it fixes. So I follow what you're saying. I follow what you're saying, but this should make things at least marginally better, maybe
Yeah.
a lot better.
Okay.
I
I
mean,
don't
I
want
like that
to.
I can search
Yeah.
for my phrases. You know, I
Uh-huh.
like that because you can get a lot of phrases and it can be hard to use. So
Mm-hmm.
that's a nice little improvement. And and then the thing I didn't show. Wait a minute, let me show for those of you who are women's health. I did not show that. So that's very important to them. Let's let's see. Let's come back out like this. I want to create a new encounter because to put an OB encounter into a medical encounter, it's just like it never works. And then you just click open template and I will click on homepage. Let me just do it the correct way to show you. This really, really helps the women's health staff. So I'm going to click GYN, but it's not going to be GYN. Just give me
Yeah.
one sec. Because if I
Shouldn't it
don't
be shouldn't it be
have
prenatal details?
exactly, give me one second. I will get there. Hold on, click on that. So that's good. Now I have to go to make any changes to OB. You have to start from the intake template where it becomes dysphoric. So we don't like dysphoria. Let's
Or
see.
be prenatal?
Let's try that.
Mhm.
And then let's go to prenatal detail.
Yeah.
If you don't set this up right, you end up with a lot of pop-ups. So then pause, just give it a second. This is where the action is. This and where the women's health providers view the labs during pregnancy, because you need different labs during different trimesters. So see how now you can view a log of OB problems, right? And then this is a little section where the women's health providers sometimes save phrases. So they've had to go someplace else to save the phrase. And now you have a save phrase box here, which turns out to save them a lot of trouble. Them meaning our women's health providers. So, and then you can also get a date timestamp of your note like that and put it in like that. And that turns out to be very useful for the women's health providers.
May I also confirm that you state that we are now able to input the labs into the OBGYN template rather than having to go to orders all the time?
So you don't have to input them. What they promised me on record, they were recorded saying this. They promised me that they would flow in from Quest and LabCorp.
In that
So,
area that normally does not flow in the labs. So where, can you show me exactly
correct.
where it'll be to make sure that it's there?
So it's not, you're not going to be able to check it in the practice database.
Oh, I understand, but it's in the same location that is typically not,
Correct.
okay, got it.
That's where it's, and I'm trying to remind myself, where's it supposed to be? I can't remember where you enter in your labs. I apologized for
No
that.
worries, it's okay. I just wanted to
So
make sure I heard you
yes,
correctly.
you heard me correctly. And if it doesn't flow in, then we need to make a lot of noise because
Okay,
they promised it would flow in. It means
okay,
something's broken.
Mhm.
okay.
Okay,
Yeah,
go ahead, more questions. Uh-huh.
yeah, Jackie, often patients switch pharmacies frequently, and I have to switch a pharmacy to GPHA pharmacy or another pharmacy, CVS, whatever. Where is the patient demographics? It's usually on the right side. So I can, click Greater Philadelphia and then put the name of the pharmacy and the zip code and then change the pharmacy.
So the way to change the pharmacy, there's two ways. Well, not that, I don't want to show you that way. The way the medical assistants will do it, have been trained to do it, is to come to GPHA patient and use the pharmacy tab. But when you're actually in the med module, let's say I want to renew this. I'm not, it's just a med.
Yes.
And then you just like, don't worry about it. That's propranolol. I have to click all these things because you're not, maybe you don't get it when you're pregnant. Then you click send. Then do you click no if you wish to continue? Yep, I want to click no. Then this is where you would change it, and that has not changed. The pharmacy search box. Just an aside for others, this pharmacy search box, sometimes patients want you to send it to a mail order pharmacy. And if you know the fax, you can search by fax. That can be useful. The other little button that, since you asked, see that button, add pharmacy to system? If it's not in our system and you know the fax, you can re-enter the fax number here or the name of the pharmacy and get it added in. So like, why do I have to add a pharmacy? Why can't the system do that? Our database carries everything within 40 miles of Carmore Health Center. That's our center. If it's more than 40 miles away, we have to go out and add it. Otherwise, it would be just too big to work with. So that's the answer. And this, by the way, is not a new feature. It's just not, if this button's just not something I've really trained on very much. Most of the time we don't need it. Did I answer your question, Dr. Maybine?
Uh, it was so much easier the old way.
I'm not sure what the old way is. It's not really clear to me what you're talking about.
On the right side, it says patient demographics, and you click that, and then you click GPHA, and then it has the demographics of the patient, the
So
PCPs, and the
the
pharmacy.
demographics are here. It's here in patient demographic, GPHA patient.
Okay, where was it again?
GPHA patient, it's
Uh-huh.
pretty much where it has been.
All
It's
right.
right there.
Okay.
Could you click on that, Mrs. Rixier? Because I was accustomed to the categories at the very far left and coming in next to that patient demographic, and then you would go down and click on patient demographic and you get all of the demographics, including emergency contacts, all of that stuff. And if you wanted to
Is
update,
that
you
what
could
you mean?
update.
This? I showed you this by clicking here. You get this modify patient information button.
No, no, no,
Okay.
because I could even click on patient demographics at the far right and then check to see if the patient had insurance. You know, if you go to, you're in the new system now, so you can't go to an old chart, but um,
I'm not going to belabor the point. At some point, if you could just look at an old chart and look to the far right, you'll see what I'm talking about. And then we can chat. So I'm not holding up the
Okay,
group.
right,
Thank you.
right. Okay, I'll take a look at that. And you and I can maybe meet at the end. Just as an aside, Dr. Young sent a very important email. She wants everybody to look at it. It's about the PAQ. And then Melanie had a question, does MDC stop early as well to allow time to close charts and clean up the PAQ? And I'm going to have to pass that, let Dr. Whitmore answer that. But that's a good question. I don't know the answer to that.
Hi,
Oh,
that's a very important question. And no, we did not make any arrangements for the medical day call to stop early. But let me know. And I'm not sure, I'm assuming, Melanie, that you're on MDC tomorrow afternoon? If that's the case,
Yes, I'm
okay,
on all alone tomorrow, so if it
okay.
happens to be really busy like it was today, I don't know if I'll have time to close my charts.
Yeah, great. Thank you. So you and I can talk tomorrow because I may have to assign somebody else to help you out.
Okay, thank you.
No problem.
I'm glad you thought of that, Melanie.
Definitely.
Now, I do want to go do a couple of updates, workflow updates, and then we can, hang on one second. Give me 1 second. Okay, let me go back to my handout so that I can show you these updates. Give me 1 second. There we go. So we looked at that and I showed you all of that. 1 second. Yeah, we talked about that. We talked about that. We talked about morphine milligram equivalents. We talked about adding phrases on 1 click. We talked about OB phrases. We talked about PAQ phrases. We don't need to go through that. Oh, minor update for PAEDS people. There's now a checkbox for hepatitis C. We still have to put it on the problem list. NextGen acts like this is such a big deal. The gestational age at birth will flow over from the newborn template into the vital signs template for kids under 2 years. That's nice. Importance of autism screening. There's no change to the previous workflow, but to do the autism screening, we don't want to click in these MChat buttons. That's not what creates the code that goes out to the insurance company. So one more time, we do have to click other screenings, add new, and then add in the MChat and the status of it. So that's not different. The patient portal, we can filter this just by patient. And you can slide the patient specific view to on. We don't ask our providers to manage messages from the portal, so it really doesn't affect current workflow. A plug for lead screening. Our lead screening is declining. In 2023, we screened 88% of our 2-year-olds, and it's 2 tests by age 2 years. Now we're down to 78. The national average is 69, so we're still better than average, but we aren't as good as we were. So please do that. Just as an aside, these are real graphics that were used to sell lead paint back in the 40s and 50s. White lead lasts. That's why people got it, so they didn't have to repaint their wood window frames in the days before vinyl windows. And they flavored it to be sweet. That's why the kids go after it. And it stays in the soil. The Frankfurt area is home to about half of the lead smelters in the city. And then whenever there's demolitions or new construction, the dust gets kicked up and that's our patients are exposed. Fun fact, adults who are lead exposed can get hypertension. How interesting is that? Referral reminders. So we are asking that you manage your referrals for high risk items from the PAQ. And I'll show you how to do that in just a second. But high risk is OB ultrasound, cancer screening, and anything that is pediatric diagnostic imaging. So why complete from there? hang on 1 second. I need to mute whoever, if there's somebody who's competing with me. I just need to look through and mute everybody. Okay, gotcha. All right, so I'll show you now how to complete from the PAQ. Let's see, there's development. There we go. There's the PAQ. So wait a minute, let me make that bigger so you can see. Oh, you really can't see here. How about if give me 1 second. Let me show you from the real database. I don't want to exit, but let me bring real NextGen over and show you how to do that. Yeah, and then this is the real live database. Just give that a second to come up, log on, and let me see if I think I have a couple things in my PAQ and I can show you. Yeah. So see these little, this will be the same in the test data, in our new system. You'll have these little test tubes down here and you'll be able to go, was this an ordered radiology test or an ordered referral? And if so, you would click on it and then click the complete button. Now, because this is not, this patient, it looks like, oh, this is on a real patient. We did not order this mammogram on this patient. That's why there's nothing there. So I have to actually read this because now I'm getting distracted trying to read it and manage it and I can't. So this was something we were CC'd on, and you can see that the referring provider it's a Penn Medicine provider who used to practice here. So she must have ordered it out of Penn Medicine and we're CC'd on it over here. So that's how to complete from the PAQ. Now let me see if I can move this out of the way. And let me move this out of the way. And come on. All right, you're not want to let me do that. Okay, there we go. So that's the ask. It also reduces your liability because if you keep ordering that mammogram again and again and again, the patient keeps not going, then you do need to like manage it from order management and say in order management that the patient is not doing what we asked them to do. So let me see if I can get in here. And this is now development again, but it should work the same. Hang on 1 second. So if I go to order management like that, and I go and I see, sorry, this should be better. If I go to diagnostics like this is another thing that got fixed. You should be able, see how it sorts now? It wasn't sorting before. Wasn't doing a nice job with that. But if I keep ordering this and the patient doesn't go, what I have to do is click canceled and say that they were non-compliant and click save. And that's the ask only for the past 2 years. I might have done this to a very old, I might have done this to something very old, but that's the answer. It reduces your liability rather than ordering interesting new things. It's better to manage the things that we've already ordered. So I showed you that. People have heard that it doesn't work to complete from the PAQ. It does. It's been working. You will have to refresh order management if you decide to go back and really make sure it works. You have to close it and then open it, but it does work. You can't control whether the patient goes. That's true. But it is important to address the things that have been ordered previously. The Azara data link is right up here that we talked about. Once you click on the Azara data link, it'll tell you the last couple years of what's gone on with the patient. And then the ask is that you go to order management and just look at the last 2 years. The definition of complete is telling the patient, of completing is including telling the patient. Now, many times, Penn, Jefferson, Temple, they'll tell the patient their mammo results. So you don't have to do it twice. You do have to tell patients their results. So if it's let's say it's you did a foot x-ray, you do have to tell them those results. If they don't answer the phone and they don't return to their appointment, I recommend that you send them a letter. And I can show you how to do a letter. Just an aside, sometimes the note's not generating in NextGen, and what I've seen this happen is in the telehealth visits, especially if somebody chooses virtual visit for the visit type, don't choose that for a visit type, choose office visit. You do want to practice. You can practice now, I'll stay on, or you can practice on your own. It'll probably take 15 or 20 minutes to get used to it. You can generate the practice note using the preview button. In the med module, you may see a lot of these pop-ups in development. Don't let that worry you. It's just because it's not connected to the internet and it likes to be. There's been some minor updates to the patient portal status icon. I'll let you read that on your own. They're not that important. I explained about Windows Integrated. You have to hit that drop down. And now we're done. I'm done with all my little training things. Thank you for kindly listening. The main meat of the training is complete at this point. I'm going to leave the recording go for a little bit and then I'll stop the recording. But is there any other questions now? And if you have something you don't want to be recorded on, go ahead, Patty. You have to unmute though. We can't hear you. You're muted.
So I clicked over to integrate a couple days ago, and my configuration of my NextGen didn't change. So I'm guessing because I have no frame, I'm still in 7 and I don't have 8. Would that be correct?
So not exactly. It's not clicking over to integrated. You actually have to click the icon on your desktop that says development. So hang on 1 second. It's not clicking integrated. Clicking integrated is not going to do it. It has to say NextGen Devel or
Okay.
NextGen Devel RDP.
Okay.
All right, that's how to get it in.
Okay.
Clicking integrated will not make a change because if you click on NextGen MFA, that's getting you into the regular database.
Okay. Thank you.
Other questions? So I'm going to stop the recording.